Thank you, Dr. Wright, for leading us through the member updates and Q&A session. As the catalyst for cross-sector collaboration, the National Forum values its members, and I'm always excited to hear what members are doing and thinking. Hypertension control takes a lot more than good medical care. An environment, social norms, and services that make it possible and even easy for people to live heart-healthy lives are essential. In this segment of our convening, Jen Childress is going to talk with Mayor Warren about how she leads Fontana residents to prevent hypertension and obesity and maintain their physical and mental health. After the conversation, Jen will give us thumbnails of how other mayors are using Move with the Mayor to improve health.
Thank you for joining us today, Mayor Acquanetta Warren from Fontana, California. Mayor Warren, you're a champion for health and well-being in your community and an active Move with the Mayor participant. Not only that, you walk the walk. Over the past 5 years through the Fontana Walks program, your community's logged nearly 5 million miles. Congratulations, that's amazing.
We've got an amazing community.
That is so cool. Why have you made health a priority for your community?
You know, it started as a personal goal. You know, I've lost about 89 pounds since I've been on the council. And it started when I got appointed. I had all black on. You know, black's supposed to make you look thin, right? When I saw the pictures of my appointment, I was freaking out. I told my brother, he's like, this is great. And I said, I'm huge. But I did it for the wrong reasons. I was worried about how I looked and all of that. But we called Kaiser to do a presentation. I had this idea I was going to be Oprah, have everybody on the middle of Sierra, put all our fat on a big truck, you know. And when they sat down and told me the heart rate problems that our public was having, and what really hurt my heart was the diabetes amongst children. You know, I was going to schools, introducing myself, and there'd be a line out the nurse's office, and I'm like, what are they doing? And they explained to me, those are the children that have to take their insulin. Can you imagine at recess? So it really disturbed me. So then I also had the issue of, we know that in African Americans and Latinos, we cook differently. We use lard, we use oil, we use all this grease, you know, bacon fat. You know, I'm not giving up my collard greens or the flavor, but there's better ways of doing it. And my friends that make their tortillas and all of that, we've all worked hard together using grapeseed oil and all those things that help us be more healthier. But the real challenge for me became even more clear as I learned more about the problems with women. You know, there are heart disease and all the things that were going on. You know, if you keep mama safe and healthy, then you keep the family safe. So I focused in on the women and I said, bring your men along, you know, because they're not healthy either.
Absolutely.
So it's opened up a whole avenue. So we came up with Healthy Fontana. My daughter, you know, we started Healthy Fontana. And now we've evolved with Kaiser giving us our first grant in 2003, $5,000. We've received so many grants from Kaiser since then. And this program has become a model throughout the country now. Fontana Walks has evolved into not only a walking pattern for people, it's a chance to come out and talk to each other. And we all know during COVID, that was important and we did it safely. We walked ahead of each other, but it allowed us to get out in the open. And that's when I really focused in on my last 52 pounds.
Wow.
But I've got 40 more to go.
Well, you are doing amazing. I love that you've shared in terms of your personal story and then reaching out to women and children and in just challenging community members to make healthier choices and making the healthier choice the easier choice through the supports you have in place. So how have you received buy-in from residents and businesses that support your leadership efforts and prioritize health?
Well, first thing I tell people is, you know, I'll never be a size 2. I wasn't born a size 2. It's not about this, you know, I can wear this and wear that. It has to be about your health. You need to go to the doctor, get your examinations done. But more importantly, we made it a planning effort where we look at how the trails, we got 48 parks in Fontana. They provide the best recreation. The kids particularly enjoy when I come to the elementary schools. They all want to tell me about how they're eating fruits and vegetables and they're not eating as much candy. But everything is in moderation, and the public loves it. We just had Fontana walks at our Fontana Park, and now we're bringing the fur babies in, and we give them scarves. So we've got some dogs that have become celebrities because they're walking with their owners. So we have fur
Amazing.
baby parties. So it's great.
Very cool. You're making it approachable, making fitness fun, and really encouraging and embracing what the community is offering. So, how does Healthy Fontana and Move with the Mayor empower residents to take control of their heart health, including controlling their blood pressure?
Well, the big issue is education. We have booths when you first come in,
Mhm.
and we feature. Now we're working on mental health. See, that's the thing about a health component. It can include the circle, everything. So we
Absolutely.
had this last walk, we had the mental health people there as well as we were doing colon testing. And so you got a kit, they showed you how to do it in the comfort of your home, and you could get the results done. And that was the great San Antonio hospital. Kaiser has come out. We have blood drives. We take advantage of all the resources from the county too. The county
Okay.
is always out there. And we have fruit people. In our parades, we have the people that are going to be raspberries and tomatoes, and they're in the parade, and we have a ball. And our parades include about 80 to 100 people walking in the parade. So
Wow.
we do everything we take advantage of. If somebody comes in and says they have a program, it is vetted, and we use them at our things. We just did a storybook walk, and the kids loved it. The parents were happy because they got to walk, and the kids got to read a book and follow the path of the story. So we try to be as creative as possible.
Oh, that's incredible. I love that. Raising awareness, education, and talking about health holistically. So, knowing that mental health pairs with physical health and heart health, particularly, and that you're connecting with the health department and programs. So, what are some specific ways that you address health equity related to cardiovascular health?
We right now we're focused on the Fontana Walk program, and we're focused on bringing vendors that do that type of thing. But we just had our state of the city, and we know that COVID provided problems for people that got COVID. We're
Mhm.
currently researching with our partners. See, we have partnerships with the county, with the different health agencies. We have a health fair. We do more dental now because we know now that the kids' teeth have a lot to do with their health
Mm.
and the parents too. And some of our children haven't seen a dentist in forever. And we also try to advocate to get more people signed up for they call the Obamacare program to with California compete. I mean, we're trying to get people to take charge of you, know your numbers. So we're going to be introducing that program later this year. Know your numbers. Find out. Don't wait till you have a stroke. Find out if you're diabetic. Get your blood work done. Get your urine tested. We have. I just spoke to a gentleman that got prostate cancer,
Mhm.
and he said, "You saved my life." Because you mentioned that in one of your speeches, and I told my wife, I don't think I've ever been checked for that. He
Wow.
said, and they caught it early. It's just communication, and we do a lot of that. Our community services department is second to none. Anything they can do related to equity, they try to do. And we make sure that if we find people that are in that space, we incorporate them in our programming. Some of
Awesome. You're absolutely leading by example. And I love that everybody's invited to join in. Access is a big component of what you do and really connecting those services within the community to community members.
And then
And
there's so many other programs that are occurring around the county that I participate in, and we bring people to the table. But equity is big because we all know that's the problem with medical services is it's equitable. How do people relate to African Americans and others when they go into the doctor? You know, it's a very intimidating process. So I've been thinking about this, and I've been hoping that at some point we can do some interviews with different people to tell us how to navigate when you go to the doctor. I'm still learning myself. I love my sisters. They advocate for me when I go to the doctor.
It's so important to have that awareness and tools for communication, knowing what to ask and knowing what to expect and having that support system. So that's amazing that you're spreading that throughout Fontana.
But
Um,
people always say that, is that a city's job? Yes, it is.
mm,
The quality of life for your residents depend on what you provide them.
that's powerful. That's absolutely powerful. And that's such a great point and segues into today's audience represents patients, clinicians, public health advocates, and business leaders. So, what's one piece of advice that you'd offer our audience members to help them get their mayors to promote community health where they live?
You know, I love using quality of life. If you look at quality of life, it's not just economic, it's mental, it's physical, it's holistic. And part of that is you've got to make sure that the services you offer, mayors, provide that for everyone. And if you're not doing it, if you're just sitting up there worrying about policy, that's fine. But make sure the policies relate to how people's quality of lives are improved. And if you do it right, this will be one of those components.
Thanks so much for being part of this initiative and Move with the Mayor. Keep walking, and we'll catch you later. Thank you.
Thank you.
Here are a few more highlights of what mayors are doing throughout the nation. They're using messaging provided by the National Forum to raise awareness on the linkage between physical activity and blood pressure. As you can see in these examples, through their city's personal and social media accounts, mayors are sharing important information and encouraging their community members to get active and to know their numbers. Additionally, mayors are creating their own messages to promote heart health. Mayors are leading by example, often banding with other community organizations and efforts, sharing calls to action to people in their community to get their blood pressure checked along with other health screenings. And they're out in their communities demonstrating heart health as a way of life, whether it's through walking meetings, creating videos, encouraging people to make heart healthier choices, banding together with local business groups, or joining elementary kids. Mayors are walking the walk and empowering their community members to live their healthiest lives. For more information on the Move with the Mayor initiative and to get your city involved, visit the link on the screen.